Welcome to the Thorax and Lung Assessment. During this module, we are going to describe the anatomy and physiology associated with the respiratory system and correlate different physical exam findings to normal physiologic or pathological processes. So when we look at the contours of the airway, we have the upper and the lower airway. In the upper airway, it consists of the nasal cavity, pharynx, and larynx, which all help to kind of conduct the air down into the lower airway. When we look at the lower airway, it consists of the trachea, the bronchi, and the lungs. And this lower part of the airway starts off with what we call the conduction zone. And these are the different bifurcations of the bronchi that take it down into the respiratory zone. And you can see that there's many different levels of bronchi consisting of the right and left main bronchus, leading into the different lobular sections. And again, it facilitates and leads the inspiratory air into the respiratory zone. The amount of mLs that is in the conduction zone is approximately 150. And so let's go ahead and familiarize ourselves with the different aspects of the lungs when we talk about the anatomy. And so in your handout, you can go ahead and fill this in on your own diagram. And so we'll start from the top when we look at the different structures. So at the top of the lungs are considered the apices of the lungs, and the bottoms are considered the base. And so it's very important if you're trying to describe different types of pathological conditions to know exactly where in the lungs that particular condition is. So when we look at the different lobular segments, what you're going to see is on the right side, you have your right lobe, and on the left side is the left lobe. But the right lobe is made up of 3 segmented parts. So we have our right upper, our right lower lobe, and our right middle lobe. On the left side, you can see that we have our left upper lobe as well as the left lower lobe. The reason that this is important to understand the anatomy of the lungs is because when you're listening to the different lung segments, you have to know which lobe you're listening to, and that can tell you a lot about the different pathological process that could be present. In addition to that, you can see we have a notch, which is considered the cardiac notch, and this is then where the heart sits within the chest cavity.